Hey everyone, welcome back to the channel where we discuss medical topics and lifestyle. Today's video, we are talking about alcohol withdrawal. So this is a pretty interesting topic. Alcohol withdrawal occurs in patients who are alcohol dependent, who have stopped or reduced their alcohol intake within hours or days of presentation. We're going to talk about what it is. We're going to talk about the symptoms around it. We're going to talk about delirium tremens, which is something you often hear about. We're going to talk about some treatment, and we're going to talk about support that's available. So these are all very interesting things we're going to be talking about. Alcohol is a big issue in the world. Plenty of people drink, plenty of people have alcohol problems. So let's get into the video. Okay, so let's first define what is alcohol withdrawal. What exactly is it? So plenty of people drink, plenty of people have drinking problems, but what exactly is it? Alcohol withdrawal occurs in patients who are alcohol dependent and who have stopped or reduced their alcohol intake within hours or days of presentation. So that's what withdrawal is. But what is actually dependence? So what does alcohol dependence actually mean now? So what is dependence? Dependence is a chronic medical condition that typically includes current or past history of excessive drinking, a strong craving for alcohol, continued use despite repeated problems with drinking, and an inability to control the consumption. So that's what dependence is. There's a lot of terms there, but that's what it is. If alcohol withdrawal is not treated or is inadequately treated, 5% of patients will progress to alcohol withdrawal delirium, known as delirium tremens. And that's crazy because that's a very bad thing, as we'll find out soon. All right, so let's get into some mild and moderate withdrawal symptoms. So not all patients with symptoms of alcohol withdrawal need medication, need pharmacological treatment, right? So we've all felt some mild symptoms, or a lot of people have felt mild symptoms after just having a simple hangover, right? Drinking for a day or two and having some hangover symptoms that can be classed as mild symptoms as well. So let's talk about these symptoms now. And this is actually where it gets interesting, because how do you go from somebody with mild symptoms to somebody who is actually alcohol dependent, right? How do you differentiate between the two of just having a simple hangover to somebody who is being impacted dramatically by alcohol? So we have the mild symptoms of insomnia, fatigue, hangover symptoms, right? So mild anxiety, palpitations, your heart is racing, you're sweating, you're a bit restless. And then when these things get very much worse, and then the restlessness, the tremor, and the worsening of the symptoms in general start to happen, that's when we class that as moderate. Again, not all mild or moderate require medication or intensive management, but this is something to keep in mind. These are all the things that make this a very interesting topic, because how do you distinguish between somebody who is alcohol dependent versus just somebody who is having a few symptoms here and there? The most important thing, more than anything else, is to take your time discussing it. You don't want to be judging people, labeling people, things like that. You want to take your time discussing it. You want to be sensitive about the topic, and you want to avoid being judgmental or using such languages, because it might not be alcohol at all, right? So these are the things you have to play in your mind when discussing alcohol dependence with somebody. The last thing you want to do is take a non-sensitive approach, and then the person can get defensive about your questioning, or the fear of being labeled an alcoholic, for example. So this is something you have to take an approach with much caution. Now, there are definite ways to approach these kinds of conversations with people. If you're having a very open conversation with them, you can do certain questionnaires that are available online, such as the FAST questionnaire, the FAST questionnaire. So those are questions where you ask around, have they had any blackouts? How much alcohol are they drinking? Is it impacting their day-to-day life? And of course, is there a curious history about these things, right? So, is it alcohol at all? But is it alcohol at the end of the day, right? So is there a history of falls? Is there a history that points us in that direction? But again, approaching the matter in a very sensitive way. Now let's get even more serious. So let's talk about the severe withdrawal symptoms. So this is something we must address. And the most important thing about it is, if we think somebody is having severe withdrawal symptoms, we need to identify this as early as possible. That's the absolute priority here, because there can be dramatic effects. The way to identify somebody who is having severe withdrawal symptoms is to have one of the following. So after you've admitted them, or after you're already caring for them, if they have a seizure, that's a big red flag. If they have a deranged temperature, blood pressure, glucose, that's a big red flag. If delirium tremens is coming on, which I'll talk about in a sec, that's a huge red flag. If it's not improving after management already with benzodiazepines, and if the scoring systems are too high, then that's a problem as well. I'll link those in the description below. What is delirium tremens? So this is a huge red flag. It's a rapid in onset, very difficult to control. It's life-threatening. Let's put it straight. It's life-threatening. It tends to appear 48 to 72 hours after our last alcoholic drink. So this is a life-threatening condition. If you don't get on top of alcohol withdrawal delirium tremens, it's fatal. In about 15 to 20% of patients, if it's untreated, it's fatal. So this is a huge problem. You need to get on top of it. You need to prevent it from even happening. Appropriate early management reduces mortality to around 1%. So that's the benefit of management. So it's really, really important to identify it, treat it, get on top of it, and prevent it. So essentially what it is a profound confusion or delirium, clouding of consciousness, hyper-alert state, hallucinations, and pins and needles. So it's really, really problematic. It can be fatal. It's really important to get on top of it, like I said. So how are we managing this? I spoke about benzodiazepines, medication a little bit. So how are we actually managing this in hospital? So when we have somebody who's unwell due to alcohol, how do we manage this? So supportive care, that's the most important thing. We have to rehydrate the patient. We have to replenish their electrolytes, and we have to establish a good glucose control. So that's the most important thing when it comes to supportive care in the hospital. And then we talk about medication. So when are we actually going to give medication? So we have to use our clinical judgment in combination with some of the scoring systems we mentioned earlier on and linked below, in combination with how the patient's presenting, right? So that's when it comes to acute pharmacological treatment. Using a benzodiazepine as first-line treatment, if a patient needs pharmacological treatment, that's the first gold standard. Benzodiazepines are used to control psychomotor agitation and prevent progression to more severe withdrawal symptoms. They can be used specifically for the treatment in alcohol withdrawal seizures and alcohol delirium, and they're usually given intravenously and also a fixed dose regimen or adjustable dose regimen. And then there's nutritional support. So we give thiamine. Alcoholics are very nutritionally depleted, so we give thiamine, vitamin B1 to prevent Wernicke's encephalopathy. We'll make another video on that. You give at least one intravenous dose of a high potency vitamin B preparation, and you give this to all patients. So even the mild symptoms, not just the severe like the benzodiazepines, but you give it to the mild and all patients who come in with symptoms. So let's recap everything. So if there's alcohol involved, if there's symptoms of it, we suspect withdrawal. If alcohol withdrawal delirium is going on, then that's left threatening. Not all patients need drug management, but some do, in which case it's going to be benzodiazepines, but we have to use our clinical judgment in combination with other assessment tools for that. And then finally, we have a big question to ask ourselves. What do we do after we are discharged from the hospital? So it's all fun and games to treat the alcohol withdrawal symptoms, but what are we actually doing after we go home from that? So the most important piece of advice to give to somebody is to never advise to stop suddenly drinking alcohol. Right? Don't suddenly stop your alcohol intake. That's the most important. It sounds counterintuitive, but that's the case. The other thing is to try and assess formally by alcohol addiction services. So have a proper prevention plan in place going forward and treatment for the long term, not just in the hospital. Gradually reduce the intake over several weeks or months, the alcohol. So not by more than 25% every 2 weeks. That's often the recommended way to taper down on alcohol. You often and then finally, going forward, things to advise them is to think about their habits, their alcohol habits, right? So do you often feel the need to drink? Do you get in trouble because of your drinking? Do people warn you about how much you're drinking? So these are the things that you advise patients. So you don't just treat them in the hospital for their acute issue, but you try to set them out with a plan so they can aid in preventing the issue from happening again in the future. And there we have it. That's it for this video, guys. Alcohol is a huge problem. I hope you learned something here. I hope it helps somebody benefit in the future. Like and subscribe for more. Leave a comment in the section below, and we'll see you in the next one. Take care.